This tobacco control project aims to build, enhance, and equip selected African countries, civil society organizations, and institutions with the knowledge, skills, and resources to enable them to develop the effective tobacco control policies, implement these policies, and monitor progress. The program addresses the inadequate institutional and human capacities that have hindered progress in adopting and implementing evidence-based tobacco control strategies, which are critical for curbing the detrimental effects of tobacco consumption in Africa. If nothing is done, tobacco consumption is likely to soon become a leading cause of major public health issues and death in Africa.
ACBF is strengthening organization capacity and human capacity of institutions that promote tobacco control in Africa. This arrangement is guided by WHO Framework Convention on Tobacco Control. ACBF is therefore supporting 12 civil society organizations in 11 countries. A number of arrangements are put in place to ensure capacity building of programs, work planning, ensuring that governance and fiduciary control are sound, routine monitoring of programs. All these capacity services are delivered to ensure effective and efficient implementation of programs.
La phase actuelle du programme de lutte anti-tabac a commencé en décembre 2014 et les résultats en termes de renforcement des capacités institutionnelles de nos partenaires se traduisent au niveau des pays par un meilleur plaidoyer de la part de la société civile, une mise en œuvre effective de la loi par le gouvernement du Sénégal et plus d'assistance technique de la part d'institutions comme l'Université du Cap.
The grant from ACBF has allowed us to give a lot of scholarships to students that have done work in the economics of tobacco control at the University of Cape Town. Subsequently, many of these students have remained involved in tobacco control activities either at the university or in other contexts. The second thing that the funding has allowed us to do is to open doors in Africa, specifically for organizations that are involved in all kinds of tobacco control activities, and those doors would have otherwise not have been opened to us because we do not know who these organizations are. And the third and last very important thing is that the funding has allowed us to generate new grants, to apply for new grants, and to become much bigger than what we were 5 or 6 years ago.
The project has also helped in building the institutional capacity of ATCA so that we can contribute in a more effective and sustainable manner in promoting health and tobacco control across the continent.
The support from ACBF has enabled ILA to strengthen its governance system and build its human resource capacity for tobacco control, which has influenced our research in tobacco control economics that has then provided evidence for policy influence on tobacco control in Kenya.
The ACBF project has done two things for my organization. One is building the capacity of CISLAC in terms of its procurement processes and other administrative processes. The other one is to engage government, the legislator, and other civil society groups as a leading tobacco control advocacy group in Nigeria.
So I think I've benefited in three ways. The first is the opportunity to be exposed to an area of study and research that I've never been exposed to, the economics of tobacco control and just tobacco control in general. I have a background in malaria and I wasn't exposed to tobacco control before this. The opportunity to be able to do this kind of research and study at one of the best institutions in Africa, the University of Cape Town, is the second. And I think the last is more on a personal level, which is the opportunity just to live in one of the best cities in the world, Cape Town.
Yeah, the project has been very instrumental in expanding the institutional capacity of CTCA in terms of capacity building, to have a structured approach towards tobacco control on the African continent through supporting establishment of the National Tobacco Control Programs.
La Fondation a déjà plus de 4 ans d'expérience dans la mise en œuvre des programmes de lutte anti-tabac et le soutien à des organisations sur le continent. Nous avons l'intention d'élargir notre horizon d'intervention pour soutenir plusieurs autres pays et institutions afin de promouvoir et renforcer la lutte anti-tabac en Afrique d'une façon pérenne.